AFMC is really known.
And also make sure
Hello and welcome into this week's edition of AFMC TV. We're glad you're joining us. Today we are talking about a very important pediatric topic, and for that we've brought in our resident pediatrician, Dr. Chad Rodgers, here, also Chief Medical Director at AFMC. And boy, there's been a lot in the news about children and obesity and weight loss, and even the possibility of weight loss surgery and drugs for children. So let's kind of level set. We know that, was it 2019 or 2020? Maybe it was 2021, when we started getting the data and the research that childhood obesity, the kids were doubling those numbers. Mm-hmm. And that was right after the pandemic, I think, if memory serves me.
Right. So during the pandemic, there was a huge increase in the number of children that were dealing with obesity. We saw weights go up, and we really saw an effect. I mean, we already knew that obesity was a problem in the United States, and the pandemic made it any worse because what we were doing, we were staying at home, and we were doing a lot of comfort eating. There wasn't the normal social supports like school, where you get PE or just the activity of going to school. Sports were just completely lost. So, but because we sort of collect that data, so every time you go to the doctor, we get your height and weight, and we calculate what's called a body mass index or a BMI. And so that's the number one way that pediatricians and people who take care of children look at weight and kind of measure weight, because you have really tall children for their age, really short children for their age. So you're trying to find a good way to kind of compare their height and weight so they can give you a good number to kind of work with. And we saw that number go way up. Yeah.
So then that sparks conversation, and rightfully so. What are we going to do?
Right.
And now we're having conversations, and I have to say, it kind of surprised me that there's actually some talk, some suggestions about talking to children about weight loss.
Right.
Rather than, and I think back to when I was growing up, rather than, well, you are still growing.
Right.
You are likely going to grow out of this. Mm-hmm. Let's give it a minute.
Right.
Let's put a pin in it for a minute. But now it seems like, no, maybe you won't grow out of this, or maybe there are now other health factors that we need to take into consideration.
Yeah, it's a topic that's really having a huge shift in the way we talk about it. And you're right. I mean, one of the great things about being a kid is that you can grow taller. So if you can maintain your weight, you can grow into that weight. But the problem is talking about this topic is very sensitive. It's a hard one to bring up in the exam room. It's one that's associated with a lot of shame.
Yeah.
And we know that there's a lot more factors involved. What we do have to realize as healthcare providers and people who work with children, it's that the mantra is eat less or eat better and work out more is not working. These kids are getting more and more obese. And that's because the problem of obesity, which is a chronic health problem, people don't just deal with it within their childhood. It continues from childhood into adulthood, that it's a chronic medical condition that has to be addressed over time. So trying to reduce that shame and recognize that there's a lot of factors involved. Like, do you live in a neighborhood where it's safe to go out and work? Do you live in a family who knows about good nutrition? Is it, that this is really a family problem? It's just not the one child problem. And so, and then recognizing the huge impact of mental health on obesity, depression, anxiety definitely make obesity worse. Sure. And then you get overweight, you don't feel good, and the depression and anxiety get worse.
It hurts to move.
It hurts to move. So we really have to recognize the problem and reduce some of the stigma and reduce some of the shame, that it's not sort of a moral failure by a family or by a child, that this is a societal problem. In the U.S., we see not only children getting more overweight, but also adults getting overweight. We're not a culture that sort of that celebrates by doing exercise or activities. We're a culture that eats. And so we really need to begin to think about how we're going to do that as a society, and then at home and in the classroom and everywhere kids work and play.
So could we be talking about, in certain circumstances, a child could be prescribed a weight loss medication?
Right.
Or could we even, I mean, let's not stop there.
Right.
Could they have bariatric surgery?
Right. So we're really seriously considering these things. So the organization I belong to, the American Academy of Pediatrics, has just put out the first report in 15 years on the update on evidence-based practices that actually impact weight loss. What we do know is that what's called intensive health and behavior lifestyle treatment is a very effective way. It's sort of a mental health kind of a counseling, but it's very intensive. It's like 26 hours of counseling and it involves the whole family over a 6 to 12 month period. Very intensive thing. It's really not available in every community. Not everybody's going to be able to do it. Not everybody's going to have that resource. Not every payer is going to pay for it. So there's a big barrier there. But we do know that there's a lot of weight loss drugs that are available now and that are getting FDA approved for children that are 12 and up. And then for those kids with really severe obesity where you really have tried everything that they're really going to have long-term complications from their health, we have to talk about bariatric surgery. And is it effective and is it helpful? And obviously that's the extreme. Nobody wants to have surgery, but it is a good way to help people who have severe obesity that are unsuccessful with weight loss, that are unsuccessful with counseling, that are unsuccessful maybe with some medicine management. That has to be an option on the table.
So what kind of conversations?
Yeah.
Like parents, I mean, does the parent start the conversation with their pediatrician? Does the pediatrician start that conversation? Do you do it with the child there in the room?
Yeah.
How do you get into those waters?
I think people are always worried that if you talk about it, it's going to make things worse. And there's no good evidence to support that at all. Right. And it's something that has to be talked about. Number one, it is a role of your routine health visit that we do check your height and weight and your blood pressure. And then maybe we do some labs to check your blood sugar and your cholesterol and things like that. But it's a topic that has to be brought up. If your healthcare professional looks at your chart and sees that you're trending up, something that I often bring up that this is my concern. Again, it has to be in a zone in which it's safe and that it's not from a place of like, you need to lose weight, you need to stop, but begin to talk about, do a full evaluation, find out what's going on in their home. So we call those social drivers or social determinants of health. What community do they live in? Do they live in safe housing? Do they have access to healthy food? And one thing we have to get over is just because overweight doesn't mean you're like overnutritioned. Actually, a lot of times you're malnourished because you're not eating good foods. So it's not necessarily like because you're overweight, you're getting too much food. Sometimes you're not getting good quality food. So sometimes the parents bring it up and it's a concern for them. They want some help and some resources. Yeah. What I find with adolescents is they have to be worried about it too. So a lot of times I let them bring it up. If it's always kind of letting them bring it up. And if they're not, and I have to bring it up, then I have to kind of assess how ready are they, how willing are they to begin the process of losing weight. So that's called motivational interviewing. You kind of find out where they are. Are they concerned about it? Do they want to do something about it? And then what are the steps that are going to be there? Because if an adolescent isn't worried about it, they don't want to work on it.
That's right. You're wasting your time.
Right, totally.
Yeah. So what is your prediction over the course of the next, 3, 6, 9 months? Just take me through 2023.
Yeah.
Are we going to be able to learn more about this, hear more about this, or are we still just kind of testing the waters like, well, this might be out there.
Yeah, I think since
or is it here?
Yeah, so I think that since there's so much new information out there and that they've looked at the evidence, number one, we're gonna have to look at how we pay for that for society. So they're gonna have to pay for this intensive psychotherapy treatment. We're gonna have to work on getting better foods into school. We're gonna have to work on getting better activities into the community that kind of fit everybody's needs. Not everybody's going to be a football player or a cheerleader. They're going to need some sort of physical activity that meets their needs. So we know how much are we willing to invest in that as a society. I think the other thing that will be interesting is, unfortunately, we have to be really careful because we all want the fix. When we go to the doctor, we have a problem with the pill. Mm-hmm. And the pill, although now it's becoming to be accepted that the medication is a good way to help children that have already done all those things and are not successful losing weight, we have to know that that's not the solution, right? It's an option for treatment, but that also brings side effects in long term. And are these children going to have to be on these drugs long term? And that's another question. And then, of course, getting to the point of something like bariatric surgery, that is surgery. And again, you have to think about what the long-term complications are and begin to weigh, what are the risks and benefits? What are the risks from being severely obese and your effects on your heart and on your body versus what are the impact of the surgery going to be? So I think it's going to be, interesting to see what happens over the next year, over the next 2 to 5 years. And hopefully improving those numbers and giving people more options.
Sure. Well, the conversation's definitely been started.
It definitely has been started.
Yes.
It's changed, yeah.
Dr. Chad, anything else you'd like to add?
Yeah, I think we still have to kind of stick to that good old mantra. Again, this is a lifetime, illness. It's a chronic medical condition. It should be treated as something that you should see your doctor for regularly, just like you would diabetes or high blood pressure. And finally, I just kind of want to reinforce, we got to reduce the stigma. We got to stop blaming people for being overweight and help them and give them the tools that they need.
Definitely.
Yeah.
All right. Chad, thank you so much.
Right.
And thank you for joining us. We'll see you back here next week for more AFMC TV.